Hi, I'm Dr. Rob for Jefferson Health with medical news you can use. We're talking about measles. Yes, this viral infection that we thought was totally eliminated for our country in the year 2000 is making a big comeback. We're talking about this now because you actually may need to get a measles booster. If you're born before 1957, you're considered immune, that you have either had measles or you've been exposed to it. Anyone that was born between 1957 and 1989, please talk to your doctor or healthcare professional. Why? Because at that point in time, you may have gotten none of the measles vaccine or only one dose. In fact, it wasn't until 1989 or 1980 or 1991 when the second booster was recommended. Most likely, as long as you're not allergic, you can just get the booster. Be protected. Measles now is in 22 states in our country, and it's spreading. This is a disease that is a respiratory disease. If someone is in the room and coughs or sneezes, even just talks, these respiratory droplets can live in that area for about 2 hours. If you've had no vaccine against measles, you have a 90% chance of getting the measles. If you've had one vaccine, you're about 93% protected. If you've had two, you're about 97% protected, which is really good. But there's a lot of people who are either don't have the immunization or have only had one. So if you happen to be in an area, check your zip codes. If there are measles cases, you definitely want to go to your doctor and say, "Doc, I don't even know if I had the 2 shots. Can I get a booster?" If you're a woman who is pregnant, you can't get the vaccine while you're pregnant. If you're planning on getting pregnant, try to get the vaccine at least 1 month or more prior to trying to get pregnant. Why am I focusing on measles? Well, it's not a mild illness for some people. In fact, 1 in 4 adults who get the measles will be hospitalized. 2 out of every 3 people who get the measles will die. Some of the complications of measles, well, one of the most common is pneumonia. Another type, which isn't as common, but it could affect the brain, encephalitis. The early signs and symptoms of measles may start off as a cold and a cough and red eye, conjunctivitis, and a fever, maybe initially 100, 101. But within a couple days, that cold gets really bad. The fever can go up to about 104. And a couple days later, some people get these white spots in the inside of their mouth, on the lining of their mouth, and then a couple days later, they get the measles rash. Measles is very contagious from 4 days before the rash occurs to 4 days after. You know, many people ask prior to getting a vaccine, is it safe? And that's a really important question. The World Health Organization has mentioned that the measles, mumps, rubella vaccine has literally saved tens of millions of lives throughout the world. One person who has it has the potential to spread it to 12 to 18 other people who have not been vaccinated. The safety of the MMR vaccine is huge. It's very safe. In our country, people might say, "I've not seen measles." Well, you know why? Because the vaccine has been that effective. The bottom line, this is an extremely safe vaccine. Please talk to your doctor, healthcare professional. We're here at Jefferson Health, jeffersonhealth.org. We can help you.